Good afternoon, everyone. I'm Sayukta from beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans right from the beginning of civilization. You all know proper skin protection is the best thing we can do for the health of our skin today and slow down the effects of aging tomorrow. In today's era, changing weather with excessive heat or humidity increases risk of damage due to UV rays, which make skin more prone to wrinkles, melasma, and even skin cancer. We know that sunscreen is valuable from a skin cancer or sun damage perspective, as well as something that helps prevent fine lines and wrinkles. According to a survey, 67% of people in India are not using sunscreen as daily skincare routine. Several things about sunscreen that we people are not aware of and that makes us not to include sunscreen as an integral part of skincare routine. So to keep you informed, today we are here to know more about sunscreen as a skincare regimen. So let's connect today with our skin expert, Dr. Shri Sindhuja, dermatologist and cosmetologist, joining with us from Chennai. Dr. Sindhuja is associated with Venkateswara Hospitals, Nandanam, Chennai, and Sash Skin Studio, TN Nagar, Chennai. She has pursued her MD in dermatology from Sri Balaji Medical College and Hospital and fellowship in cosmetology from Government Stanley Medical College, Chennai. She has numerous publications on her name in the field of dermatology. Today, with her vast experience in cosmetology, Dr. Sindhuja will enlighten us on sunscreen as our daily skincare routine. A very warm welcome to you, Dr. Sindhuja. Hope you're doing good, ma'am.
Thank you so much for such a nice introduction. I'm good. Hope you're doing well as well.
Yes, and it's a pleasure to have you with us. We are really looking forward for this session, and I'm sure we are going to have a very informative one. Now, the thing is that we all have heard this, that sunscreen is important and we need to apply sunscreen regularly. But still, many people are yet not convinced about it, and that's why the data that 67% of Indian people are still not using sunscreen regularly, daily. So my very first question to you, doctor, is that why should we wear sunscreen every day?
Okay, so irrespective of us staying indoors or outdoors, we generally prescribe a sunscreen because number one, our exposure to light has become more. Number two, even indoors, why I'm suggesting that is, say if we were to have one light, if we had one light in the entire room, let's say 20 years ago, now we've started to have so many lights in a room. Our exposure to phone, to blue light exposure, to using a hair dryer, to everything has increased. So it's advised to use a sunscreen because it is not just sun exposure, it's a photo exposure that we need to use a sunscreen for so that we delay signs of aging and also other inflammatory conditions like acne, melasma, fine wrinkles, and etc.
Mm-hmm. So the bottom line is that we need to use sunscreen regularly and it protects us from all the harmful radiations or rays that are emitted through various sources of light, right? Now, again, many people are still not convinced and they are even confused when they go out to buy the right sunscreen for them. Now, the very first thing that comes to our mind is which SPF to choose. And actually, there are so many informations on the box of the sunscreen that many times we are confused, what to look for, what not to look for. So we'll start with SPF because that's the very basic thing about sunscreen. Please tell us what does SPF level mean, why we should know about it while choosing sunscreen.
Okay. So coming to sun protection factor, when you go to a market or anywhere, pharmacy, and opt to buy a sunscreen, three things you'll have to look at. One is the SPF. It can range from 0 to 100, 0 being like nothing and 100 near to impossible. So we advise to use a sunscreen that is somewhere between 30 to 50 is adequate. And also another thing is you have to look at the product label on it. Ensure it is PA+++. It indicates protection against UVA rays, which penetrate deeper into the skin and cause more damage, even DNA damage in the skin cells. Number three is if it's broad spectrum, because it has to be UVA, UVB, and infrared. It has to confer protection against all these rays to give you adequate photo protection, so that uh, it is helping you to reverse aging that's already happened, and to give you adequate protection so that what inflammatory disorder that you're predisposed to is kept at bay.
Right. So, if we talk about the Indian conditions, normally, what is the best SPF to choose or to go for?
Ideally, SPF of 30 or 50 is good enough.
Okay. It is also said that it's important to that how much quantity of sunscreen one is applying and how many times it's been applied, and it should be applied in the right manner. So again, we would like you to shed some light over it.
Okay, so recent studies and research papers advise ideally 2 mg per centimeter square. So that's difficult to explain it to a patient. So ideally, we say 2 finger long. If you were to take 2 finger long sunscreen and apply it on Indian skin, it's going to look cakey. Considering the climate, it's going to run out. And obviously, patient adherence to the treatment is not going to be there. So complaints to the treatment is going to be low. So ideally, we advise at least 1 finger long every application. So as time goes by, we sweat, we shed skin, we shed sebaceous glands, sweat and all that. And we accidentally might even rub the face. And we are wearing masks. So what we suggest is after 2 to 3 hours, reapply sunscreen. At least till 4 p.m., please reapply sunscreen every 2 to 3 hours. And every application has to be at least 1 finger long. And every time when you reapply, ensure you don't miss out above the eyes, below your chin.
Okay.
So the entire face till your neck has to be applied, and even your arms if your arms are exposed.
Right.
So
all the body parts that are exposed need to be covered by that layer of sunscreen, right?
Yes, depending on the indication you're using it for. If you do not have any skin issues and you're just applying it out of say, curiosity, or you just need to maintain good skin health, then any photo exposed skin has to be protected by a sunscreen. That is one thing. And it's ideal to reapply the sunscreen. And also, you don't really have to wash before reapplying.
Okay.
And also, if you were to wear makeup like yourself now, so it's difficult to apply sunscreen and then rub it off. So we suggest putting it in your palm using a dabbing apparatus like a sponge or something, and then dab it on. That way, the makeup also stays intact.
Okay, right. Fair enough. And again, as I said, many people are still not using sunscreen as a daily skincare routine, and they have a number of complaints. Many people say that sunscreen make them sweat a lot, or make their face dull or patchy, or make them more oily. It's for those who have oily skin. Now, how would you like to address these issues?
Okay, so finding the right sunscreen for a particular individual is like finding your friend among a huge crowd. So you'll have to try it out, number one. Number two, you'll have to read the labels. It has to be non-homogenic. It has to suit your skin texture and the associated disorders you already contain. Each skin behaves differently. So you'll have to try to, that's when the dermatologist steps in. So we help the patient find the sunscreen depending on the indication and also depending on the nature of the skin that the patient is having.
Okay. As you said, it's important to choose the right kind of sunscreen. It's there. It's just that you need to get the right one. And a dermatologist definitely comes to help here. Now, the thing is, normally people have this conception that only we need to go to a dermatologist when we have some issues with our skin. And but again, I think awareness over this, that you need to go and consult a dermatologist even for your choosing the right kind of sunscreen is going to actually benefit you, because this is the one thing that is going to protect you for so many things. So choosing the right sunscreen is really important, and viewers, please go and consult your dermatologist. They'll help you in choosing the right one. Now, doctor, again, there are so many formulations available these days, sprays, cream, gel, lotion. So again, it depends on skin type, etc. To go for these
Yes.
formulations.
So age. So we do not advise sprays for younger individuals because we don't want inhalation and poisoning and complications like that. Another thing, spreadability. If it's a lotion and a spray, it's easy to spread in a larger surface area, like say the body parts. But if it's the face, ideally we suggest a mousse or a gel or a cream based sunscreen. A lotion is ideally not advised for the face, and also it's more appealing to the face when most people do not want that white flaky look, and they don't want that tint to the face. And also the skin type, if the skin type is 3 or 4, some people it stands out. No matter what sunscreen you try, it stands out. Only 3 or 4 sunscreens in the market are not such opaque when you apply. So they are nice. They are compatible with skin type 4.
Mm-hmm.
And also coming back to the formulations. So if a patient has acne, a gel type sunscreen is ideal.
Mm-hmm.
And also, again, you'll have to read the label. If only if the label says non-comedogenic, you opt for the sunscreen if you're acne prone. Even if you're still skeptical about opting to go see a dermatologist, please read the label before opting for it. An ideal sunscreen should be a combination of both physical and chemical sunscreen so that you get best of both. So there is a myth in the market that a systemic absorption happens when you have a chemical sunscreen in the label. It's completely not, because you're going to apply only over the face and neck to start with. And it's only 10% of the entire body surface area. And also you're going to be applying it over a moisturizer. It's not going to get absorbed. Chances of it getting into your system and going into your bloodstream to cause any effect is very next to nil. So it's all a myth spread by influencers and things like that.
Right. I think people are really scared with the word chemical, but we don't understand that almost everything that we are consuming has a chemical name. If I ask you to go and have H2O, you'll be surprised. Why is she asking me to have a chemical thing? But then if I ask you to go and have water, you'll do it immediately, because chemical, that word or any formula, is not associated with it. So viewers, again, don't get scared of these things. Don't get carried away by what people are saying, or don't in a way try to say and follow what myth is all going around. So please go by what your doctor is asking you to do and choose the right one. Now, again, as you said, it's very important to understand your skin and then going for the sunscreen as per your skin type. We would like to simplify it a little more and try to understand if I have a dull skin, dry skin, or oily skin, which is acne prone, or a combination skin, or sensitive skin. For these 4 skin types, what kind of sunscreen can we go for?
A gel or a mousse type of a sunscreen would go.
Right.
That way it gets absorbed, and also it is the patient is not going to feel the presence of the product as the day goes by. That way they adhere to the reapplication.
Right. And there's also a kind of sunscreen known as physical sunscreen, which leaves a white cast, right? So what is that physical sunscreen?
Okay, it's a type of sunscreen. So sunscreens are chiefly divided into physical and chemical. So physical sunscreens are titanium dioxide and zinc oxide. They, by their mere presence on the skin, reflect most of the rays, thereby being present on the skin gives us protection. So there's no way they're big molecules, so there's no way they get absorbed. So people think it's safer to opt to apply only a physical sunscreen. But the downside is, the more of physical sunscreen component a sunscreen has, the more of the white cast it's going to leave on the skin. And it's not going to give you adequate skin protection. It is going to confer some amount of protection, but it's not adequate for your skin to say delay signs of aging, or delay fast wound healing like acne or rosacea. But for a sunscreen to give you adequate sun protection, it has to be a combination of both physical and chemical. So physical sunscreen is going to give you white cast. It is useful in reflecting sun rays, but it is not going to give you adequate protection that a combination of both of chemical and physical is going to give you.
Right. And as we are going to use sunscreen for the longest time of our life, then in that case, is it safe to use sunscreen on a regular basis? Are they not toxic or have any side effects on us?
No, not really. So only when someone self-prescribes, like self-medicates, like self-medication, if they were to apply a sunscreen and then top it up with a moisturizer, they end up sealing the product. So what happens is there's increased absorption of the SPF that's been applied, more than what is advised. Only then there are chances of systemic absorption, and also only when it is for a longer period of time and for more than 10% of the body surface area. So ideally, if a patient were to apply it as per advice by a dermatologist, we educate them about all these, how to avoid systemic absorption and how to properly apply sunscreen. If they were to adhere to it, there is next to nil chances of systemic absorption.
Okay. Now, Doctor, there are so many people who are working from home these days, though you have already said that it's also important for you to apply sunscreen, even if you are inside your homes or offices, etc. Many people say that, I hardly go or expose myself under the sun. I normally do night shifts, so my exposure to the sun is almost nil. Now, why should I apply sunscreen then? I mean, everybody is working in front of laptop or screens or electronic devices. Now, people normally are very rigid to accept the fact that they need sunscreen, no matter where they are.
That's because of the name, I think. Because you put a name saying sunscreen, so people think it's only related to sun. It is not related to photo exposure. So we'll have to reframe the word altogether. It is photo exposure that we need to protect ourselves from. So it's the excessive photo exposure that we are exposing ourselves to. So our watching hours, our TV watching hours, our exposure to screen, our exposure to phone, all of it has increased. Even the intensity of light in every house has increased. So even like I told you before, the number of light fittings in every house has increased drastically. So all of this accumulates and gives an increased photo exposure, leading to increased photo damage. So even if we are staying indoors, it's ideal to apply a sunscreen, especially if you want to delay signs of aging, and especially if you want to escape from any of the pathological skin changes.
Okay, and again, many housewives who are mostly inside their house and they spend a lot of time in the kitchen. But those who normally do not use sunscreen or have not yet started using sunscreen as a daily skincare regime, they have witnessed or seen a lot of hyperpigmentation or melasma condition very early in their lives. Now, again, is working in the kitchen or because we are continuously exposed to the, fire or heat in the kitchen. Now, is it equally bad for our skin?
I wouldn't say equally, but it works in a different pathway to cause damage to the skin. So what it does is even heat waves, like from a blow dry, from the dryer, hair dryer, from your heat stove, from your microwave, all of these confer some amount of damage to your skin. You may not see it. I'm pretty sure you feel it, but we just tend to ignore it. So these subsequently, due to repeated damage, the body just gives up and ends up pigmenting to protect itself. So to avoid all of this, better late than never. So at least I advise every person to start applying the sunscreen above 5 years of age.
Okay.
So between 5 to 15, we say only on exposure, like say during swimming or an outdoor activity which is directly under the sun for more than an hour.
That's for the children because they, from 5 to 15, they mostly are, under the sun or swimming or into sports, etc. So at that time, they need to apply sunscreen. So are there separate sunscreens for kids or teens?
Yes. So for kids, there are more safer sunscreens with their physical sunscreen content being more and mineral sunscreen content being less.
Okay.
That way, because for kids, their absorption from the skin, the cutaneous absorption is more than adults. And also, they are not going to be aesthetically so conscious like adults. For a sports person, for a child who's like fully into sports, he's not going to be worried if it's very white or anything. So, and also directly under the sun, he needs more protection. So for kids, we advise a mineral sunscreen, and for adults, it's ideally to go in for a combination of sunscreen.
Now, again, in adults, those who are, into field jobs where their exposure under the sun is more, or are into swimming or are athletics, or, they are working as such that they are mostly exposed under the sun. Now, any advice for them apart from sunscreen or anything more than they need to add in their sunscreen?
So even before sunscreen, we advise a physical barrier, like a hat if possible, a longer sleeved clothes if possible. Try to stay in a shade when possible. So try to physically stay away from direct exposure to light. And at times, like reduce the brightness of your laptop, like reduce the number, like avoid sitting next to a window. So practical things that can be followed do give you protection to some extent, but ultimately they don't give you adequate protection. So that's when you need to apply a sunscreen and reapply, because when you're outdoors, you're going to sweat a lot. So reapply. That's when the reapplication plays a role.
And what for the people who are more into swimming? Because again, you are going to, wash it off.
Yeah, so there are water resistant sunscreens. They're not waterproof, but they are water resistant. Okay. So up to 30 to 40 minutes, you can resist the damage from chlorine that comes in. Especially when you're in water, there is reflection of the sun rays into on this water surface and into the water, and then it gets refracted into your skin. So there's more tanning, and you're exposing your skin to chlorine, a lot of chlorine contained water. So the chances of tanning is more. So that's why post swimming, everyone tans. Right. So that's why we apply a sunscreen before. So it is a water resistant coating on your skin, not a waterproof. So it reduces the chances of tanning, not an anti-tanning method.
Okay. And doctor, as you mentioned the word tanning, many people say and complain that, I use sunscreen regularly, but I'm still getting tan. What could be the probable cause for that?
Maybe they're applying inadequate amount. I'm pretty sure most individuals don't apply one finger long. Maybe they are taking only a pea-sized amount. Ideally, 2 finger long is what is advised. As what is being whenever a product is released into the market, it is being extensively researched before it is released into the market as a pharmaceutical or a cosmeceutical product. So when a sunscreen is studied, the potency that is mentioned on the label is after it's studied as applied by 2 mg per centimeter square, which is roughly 2 centimeter long, which is not possible. So at least 1 centimeter long every application. So by second application, in 2 to 3 hours, you're gonna compensate that. So you're gonna have that added benefit and reach that. But if you're applying only one pea-sized amount, imagine how many times you'll have to reapply to get that adequate amount of protection that the sunscreen promises.
Right. So it's not only about using a sunscreen regularly, it's also about using the right kind of sunscreen in the right way. Reapplication is equally important, and the amount of sunscreen is equally important. If you're not using adequate amount of sunscreen, then there's actually no point, or maybe you'll have to reapply really frequently. That may not be possible many of the times. So please choose the right sunscreen, apply the right amount, the right quantity, adequate amount. And reapplication, of course, is very important. Many people say, they don't use sunscreen because they feel by using sunscreen, their absorption or, for vitamin D will somehow get hurdled, or they'll get vitamin D deficient. What's the fact?
Okay. So we are not staying out. Number one, for us to get adequate vitamin D, it has to chiefly come from our diet. So how many of us are taking in nutrition-rich diet, which is vitamin D rich? How frequently are we putting ourselves on that? Only a smaller proportion of the vitamin D that is being synthesized is from the skin. So that number one. Number two, we are only applying on the 10% of the body surface area. So it actually, all of us are anyway going to be vitamin D deficient because our diet is deficient, which is this cheap source of vitamin D. So blaming it on the poor sunscreen is not right.
Exactly. So please do what you need to do for vitamin D. You need to have a good, balanced, healthy diet. Exposure under the sun at the right time is also important. But then don't blame sunscreen for that, and don't stop using sunscreen because believing that myth. It's just a myth. I'll also take some of the questions that our viewers have asked. Asha Singh is here asking, what are the things to look for when choosing a sunscreen?
Okay, three things. SPF. Ideally, we need to opt for an SPF between 30 to 50 at least. 30 is good enough. So when you compare an SPF of 30, if it were to give you a 94% protection, an SPF of 50 will give you a sun protection of 97%. So there's a very minute difference. So opt for SPF between 30 to 50, that's adequate.
Okay.
One thing. Another thing, if it's a broad spectrum sunscreen. Third thing is if it's PA+++. That way it's giving you protection against UVA rays, which is the most harmful component among the entire spectrum. Another thing, if you have other conditions like acne, you have to opt for non-comedogenic sunscreen.
As you mentioned, non-comedogenic, many people who have acne or who have acne-prone skin, they again don't use sunscreen, saying that it will make their acne worse, or they feel that they are not, required to use sunscreen.
So if you have an inflammatory disorder, more chances that you need to protect your face from sunscreen because the sun exposure is going to make the inflammation worse. It's going to make your acne worse. So if you were to opt for the right sunscreen, you're going to end up helping the acne to heal itself faster and then resolve so that it doesn't come back again as treatment.
Okay, so again, no excuse from sunscreen or for not using sunscreen. You need to use sunscreen in any case and in every case. Doctor, as in India, we see a lot of patients with melasma or hyperpigmentation issues, especially in women. Now, my question is, if we start using sunscreen really early and religiously follow the sunscreen, thing, the application, right, SPF, amount, etc., are there chances that we can prevent or slow down the process of hyperpigmentation or melasma?
Yes, definitely yes. Although melasma is a pigmentary condition which is caused by other factors as well, like comorbidities like thyroid disorder, anti-infective medications, other photosensitizing agents. If the patient is on, the patient is anyway going to end up developing melasma. But if he or she has been applying sunscreens religiously, the chances of developing melasma is definitely postponed. The intensity of melasma is going to come down, and also you're protecting the skin, so the extent of melasma developing goes slow.
Right. So, anyways, to slow down the process of aging or to slow down the process of wrinkles, fine lines, etc., and to slow down the process of pigmentation or melasma, sunscreen is even better. So please, if you have not started using sunscreen as a regular skincare regimen or routine, start it from now. Go take the advice from your dermatologist, get the right sunscreen, and start using it right away. We have Narendra Singh asking, which sunscreen is best for dry skin?
So as I mentioned a little earlier on in this session, for patients with dry skin, opt for cream sunscreens, cream-based sunscreens. And if it's for the face, you can't opt for lotion. So opt for cream or mousse-based sunscreen. That way, it also has a component of moisturizer in it.
Right. Okay. Doctor, we would also like to understand what should be a very basic, simple, easy to do skincare routine with very basic things that everybody can, offer. Normally, what happens, there are two kind of, person. One who don't have a skincare routine, not at all, or one who have like 100 products with them for their daily skincare routine, which can't be, actually can't be very consistent about with. Now, what should be a basic skincare routine?
Okay, so the basic is a cleanser which is pH balanced, followed by a sunscreen. If you have a dry skin type, then opt for a sunscreen which is also going to be having a moisturizing component to it. In the evening, so during the day, you will be reapplying the sunscreen, and after you head home, re-wash your face with a cleanser, which is pH balanced, and follow it up with an active ingredient, depending on your age, a serum, and then opt for a moisturizer to have a sealing effect, so that you're ready to take on the day and follow next.
Okay. And what should be the order? I mean, the right order is the same cleanser, then you need to moisturize and apply sunscreen?
Yes, the same order that I've said.
Okay, okay. Now we have Mridula Golwalkar asking, is the level of UV protection found in moisturizer and cosmetics that have SPF as effective as the sun protection factor in sunscreens?
No. So that is where they become over the counter, easily available. You can even order them online. So because their SPF is much lower, number one. Number two, they add one component of a sunscreen and then claim to be a sunscreen, claim to give you sun protection because it's only a marketing strategy. It will cheap the moisturizer, but their sun protection factor will be much low. They will still mention a component like octane oxide or avobenzone or zinc oxide or titanium oxide, but in the ingredient list, they'll be much lower. So their placement, which will be much lower in the list, hence be guaranteeing you less protection. But it's only a marketing strategy. It's not going to be as effective as a medical grade product, which is actually only a sunscreen.
So you need a standalone sunscreen. Don't go for the moisturizer. Even if you have those moisturizers, it's okay. But again, you need to apply sunscreen. Now, again, doctor, because as we are talking about other factors related or associated with sunscreen, there are people who say that, okay, I have like 10, number of products and I follow a particular brand or a company. Why should I go for a medicated sunscreen? My question is, are the medicated sunscreens better than the one sold on the cosmetic platform? I don't know what to call them actually, but yeah, by the more famous cosmetic brands.
Okay, so the difference is, the very reason is they are extensively researched.
Okay.
Now, the very reason why people are scared of using a sunscreen on a regular basis is because they don't want to end up getting toxicity. That's why a medicated sunscreen can be guaranteed of the safety, can guarantee you that it's giving you adequate protection that it promises, because they are extensively researched on patients. Not on animals, but patients as such, on people, on human skin, it's extensively researched. And hence you can go by what is guaranteed on the label.
So thus you advise a medicated one over the cosmetic one. Okay, fair enough. We have Sabah Khan asking, how long does it take for the sunscreen to get absorbed?
Like I said, a physical sunscreen stays on top and just reflects. So it can instantly give you that protection. But an ideal sunscreen is a combination of both. So a chemical sunscreen takes at least 20 to 30 minutes to react with your skin and then give you that adequate protection. So ideally, we suggest applying a sunscreen at least 20 to 30 minutes before stepping up. So don't immediately apply and then step out and then complain why the sunscreen wasn't as effective. So please remember to apply at least few minutes before, and remember to reapply because you're going to be sweating, you're going to accidentally rub your face, touch your face, wear a mask, remove it, things like that.
Okay. Sunny Arora is saying, is physical sunscreen good for oily skin?
Okay, so a standalone physical sunscreen may not be aesthetically pleasing if you have acne. So you already have blemishes on the skin, which anyone would try to hide. Applying only a physical sunscreen is going to make it look cakey. It's going to have that gray cast. So only a physical sunscreen is not going to suffice it.
Okay. Samay Jindal is asking, is sunscreen good for acne? Though we have already discussed it, but if Samay join, later in the session, then you can just repeat your answer.
No, a physical sunscreen is safe, but what we are aiming at is giving a holistic photo protection for the patient. So that's when a combination of sunscreen or combination of both physical and chemical components is only going to give the best result to the patient.
Okay. And how is the effectiveness of sunscreens measured, doctor? Sunscreen is effective, it's working or not? How to tell that?
Okay, so there's something called immediate pigment darkening. As soon as someone steps out, like if someone were to go on a holiday, immediately as soon as they step out, they're gonna tan. By the time they come home, they would know there will be one ring on the wrist, on the elbow. So there's something called immediate pigment darkening. The skin as a protective measure immediately tans when there's unprotected skin being exposed to the sun. So it takes as less as 30 minutes for someone to know if the sunscreen is being effective or not.
Okay, right. And if one is going on vacations to beach or mountains, again in mountains or hilly places, people feel that they don't need to apply sunscreen here because it's windy. It's not hot. So why the need of using a sunscreen? Again, we would like you to.
What happens is in a hilly region, number one, altitude is high, so they're closer to the ozone layer, to the sun. They're closer. Just because they don't get to see the sun doesn't mean it's not there. The UV rays are everywhere. So as soon as it passes the ozone layer and penetrates, it's going to get reflected by the snow. It's going to get reflected by all other surfaces. So higher the altitude, you're more prone to tan more. And plus cold exposure, your skin is going to break out. So your skin is already dry. You don't want it to tan also because of all the damage due to cold exposure.
Exactly. That's why we see a lot of dry skin or hyperpigmented skin in people who stays up hills or at hilly places. So again, sunscreen is a must no matter where you are, what the weather is like, whether you are indoors or outdoors, sunscreen is a must. Now, doctor, before we wind up the whole session, any take-home message for our viewers?
So let me tell you one thing. A sunscreen is a completely safe component that needs to be in your skincare regime. It is just less marketed because as much as talcum powder has become a staple of every Indian household, a sunscreen should be a staple because that is what is going to give you protection all year round. So remember to have a sunscreen irrespective of the month of the year.
Right. So sunscreen is very important for your skin. So please, if you have not yet started using sunscreen on a regular basis, start it right away. Thank you so very much, Dr. Sindhuja, for your valuable time. It has been a very informative session for our viewers. I'm sure it was lovely hearing you. Thank you so very much.
Thank you so much. You are a lovely host. Thank you.
Thank you. Thank you, Doctor. It was a pleasure having you. We really look forward for many more such sessions for our viewers in the coming times. Thank you once again. And viewers, thank you for your active participation in today's session. Stay connected to our beautiful Spotless Skin page. Thank you. Have a good day ahead. Bye-bye.